problem we're trying to solve is we want to reduce the absolute rates of advanced cancer happening in the population, right? So if we want to do that, we need to figure out before the image is taken, who should get an image and when, right? Because if you already show for the image, at this point, time has happened. Either you have it or you don't. So we need to preempt that event. To do that preemption, you need foresight. You need to understand who is likely to get disease and when, so you can do something about it to preempt that bad event from happening. So that problem is called predicting cancer risk. And if you're familiar with the area, you might think like, okay, we know age matters, we know family history matters, we know these kind of rough things. When you really look into the details, they're not fantastic predictors. They're like better than random, but not by like a huge margin, but that's all the clinical guidelines we have today. We know imaging matters, like people might be familiar with breast density. Even breast density folded into the best clinical calculators you have today aren't that accurate. They just don't give you that much sophistication. And so even with all of that, it's really hard to say who should get screened sooner or later with what modality to do something about it. So that's where AI comes in. Instead of saying, we know this thing is called breast density, that someone eyeball